Hi, my name is Steve. I'm a vet here at Summerhill Equine Vets, and today I'm going to talk to you a little bit about soft tissue injuries in the horse's foot. A typical presentation for a horse with a soft tissue injury in the foot will be a horse that's been intermittently lame perhaps for 2 to 3 months, that gets better when it's rested but gets worse again when it's exercised. Perhaps the horse has had maybe some coffin joint medication and hasn't responded really well to it. X-rays have been unremarkable because X-rays will only show bony abnormalities and not injuries to soft tissue structures. MRI is still the gold standard when it comes to assessing soft tissue injuries in the foot, but ultrasound can be a really useful, quick and cost-effective way of assessing some of the commonly affected soft tissue structures in the foot. Ultrasound is a little bit limited because of the anatomy and structure of the hoof. You've got a thick wall and a thick sole, so the ultrasound machine has difficulty in penetrating the foot to see the soft tissue structures. But in the right hands, with the proper equipment and good preparation, a lot of those commonly affected structures can be assessed successfully with ultrasound. Commonly affected soft tissue structure in the foot is the deep digital flexor tendon. The deep digital flexor muscle starts in the upper forelimb. It turns into a tendon in the cannon region, and then it splits in two in the foot. It runs down the back of the navicular bone, and between the navicular bone and the tendon there's a navicular bursa. It's a fluid-filled sac which permits the tendon to glide over the navicular bone. Some other common injuries in the foot are collateral ligaments of the coffin joint and ligaments of the navicular bone itself. This is a special type of probe. It's a microconvex probe, and it's much smaller and precise than your normal tendon probe, which you would have seen for scanning the back of the cannon bone and checking for bowed tendons and things like that. So using this microconvex probe, we lift the horse's leg and we place the tendon probe between the horse's heel buds like this, and we direct it towards his toe. We're trying to assess the navicular region, which is in here. We can turn the probe through 90 degrees, and it gives us a really good understanding of the state of those two lobes of the deep digital flexor tendon. So we've just moved inside now because of the glare of the sun, but as you can see, I've lifted up the leg again. I'm using my microconvex probe. I'm placing it between the heel bulbs and I'm directing it towards your navicular region. And if you come to the screen, you can see here's your bone, your pastern bone, and your deep digital flexor tendon. Rotating the probe 90 degrees, we get a really nice longitudinal image. Here you've got your deep digital flexor tendon, a portion of your navicular bone, and this all looks absolutely fine. So in conclusion, ultrasound is a really cheap, quick and safe way of assessing those commonly injured structures in the foot. The deep digital flexor tendon, the collateral ligaments of your coffin joint, and those little ligaments that support the navicular bone. The importance of coming to a really correct, definitive diagnosis with these soft tissue structures in the foot is to give you a really good understanding about whether this horse will come back into competition again or will have to be retired. It'll help you tailor your treatment accordingly, and it will give you a really good understanding about how long this horse will need to be box rested, how long it will need to have control, to exercise, and so on.